it's such a pleasure to introduce Dr. Bena Brown, Principal Allied Health Research Fellow in Cancer Care and an advanced speech pathologist at Princess Alexandra Hospital in Brisbane, in Queensland. Well, at least you were until a few moments ago. You've now gone to the Menzies School of Health Research. But how long have you worked prior to that at Princess Alexandra in Brisbane?
I started working here as a new graduate speech pathologist in 2002, so it's been 18 years that I've been here at PA before I moved to Menzies.
And how much time have you spent with patients receiving radiation?
I started in radiation oncology working down here in 2005, so it's been 15 years of my life, which I've enjoyed every second, and during that time I also did my PhD in radiation oncology.
And one thing you've been doing is called Health My Way. What is that, its purpose, and how does it work?
Yeah, My Health My Way is an electronic web-based patient-reported outcome tool. So in cancer research over the last couple of decades, there's been a real push to hear the patient voice and hear the family voice during their cancer treatment, because it adds so much value to the care that we provide. So My Health My Way is a way for patients and their families to connect with their healthcare team. So patients enter their data of how they're experiencing treatment onto an app during treatment, and that directly connects with their healthcare team. So referrals are made to different members of the team based on the information they enter.
If you can describe the waiting area where people are waiting to have their radiation treatment, we've often got family members with us. Where is this capacity to enter information about yourself, and 3 or 4 examples of the sort of questions you're answering?
So there's 2 different ways that people can enter their information. One is on a stand-up podium, so it looks kind of like an ATM machine in our waiting area. So patients and their families can come up to the screen. It's a touch screen. They can enter their data that way in the waiting room of our radiation oncology department. Or alternatively, people get sent out a personalised SMS message to their own device, so they can also complete their data in the comfort of their own home or when they're out and about. It doesn't have to be in the department.
So give me a sense of what sort of things I'm telling you as a patient, whether I'm doing it on the pedestal in the waiting room or on my phone at home.
So you're telling us information about how you're physically experiencing treatment, so any physical side effects you have related to pain or nausea or a whole range of different physical things that are specific to your cancer type. You're also telling us how you're managing at home practically, as well as how you're managing emotionally and how you're getting on with your family members and relationships with other people, as well as your experience of distress and things that might be contributing to that distress.
As you know, Bena, I have an interest in distress because I found the experience of radiation treatment with the mask tough. So if I was filling in the podium in your waiting room while I was waiting to go in, and I said that, while I was in the mask, I was sweating and going red and the heart was going fast, what would happen? What would happen after I reported that?
So there is a specific question that relates to mask anxiety on our tool. So people can tell us about their general anxiety, but separate to that, people can explain their experience of mask anxiety. And if your mask anxiety is at a level that is severe enough, then a clinical alert, as soon as you press enter on your data, a clinical alert gets sent directly to our occupational therapist and radiation therapists, and they're aware then from the moment that you enter that data that's what you're experiencing. So automatically a referral would be sent to those health professionals to support you during your treatment.
This is all about how to improve the patient and family experience of radiation. How does this Health My Way system improve the experience for the patient but also the family?
So we have also validated the tool for carers and family members. So there's a separate tool that carers can complete alongside the patient. And it also allows then, if the patient is doing really fine and the carer or the family member is having a hard time supporting their family member, then the health professionals can direct their care to the family or the carer in that instance.
So have you done research on this? Do you have any data on what patients and family are telling you, or the impact, the evidence that this is worth doing?
Absolutely. So we've looked at all of the data that's come out through the My Health My Way tool, and it was previously called ScreenIT. And we have over 7,000 entry points of people who are reporting their data to us during treatment. And that's resulted in patients receiving the right care at the right time when it suits them and by the right professional. It's resulted in 25% less outpatient appointments needed for patients. So if patients are doing fine and they don't need to see their healthcare team at that time, then we cancel those unnecessary appointments. So it allows people to spend more time doing the things that they want to do rather than being at the hospital.
And Bena, just finally, where did this idea come from? I mean, as a patient, I'm thrilled by it. Where did this idea come from? Because it takes the hit and miss out of whether someone notices you're in trouble.
Absolutely. So I think we conceptualised the idea in 2013, and we had a feeling that we were probably over-servicing some aspects of cancer care. So we were seeing people too much and they didn't need to see us that often, but we were under-servicing other aspects like the psychosocial elements, so the emotional response to having treatment, the distress, the anxiety. So we wanted to find a way that we could understand exactly what was going on for patients and provide the care for those specific things.